Malaria is one of the leading causes of mortality and mobility for children in Cameroon, and particularly in the north, where during the rainy season it continues to be a problem. It's really important that the drugs are administered from July to October because that is the high prevalence period. If we don't hit this window, children will die.
CRS was identified as the most appropriate partner to support the National Malaria Control Program to implement SMC. This was as a result of success stories they had in the other African countries.
SMC Sinon Malaria Chemoprévention est une stratégie de prévention du paludisme qui cible spécifiquement les enfants de moins de 5 ans.
The seasonal malaria chemoprevention methodology has been tested in West Africa for several years. What we're doing now as an agency is taking that learning and applying it here in Cameroon to target the period of high transmission of malaria in the north and far north regions of the country.
In March 2018, the USAID health officer approached me about helping them with SMC activity. Normally, to organize an activity of that duration would take about 6 to 8 months to plan out.
By the time we got everything settled out, we had about a month and a half.
I was shocked, I was surprised.
We had a real challenge.
But also it was like, how can we not do it? We gathered the team together. We put the best on this because we wanted to make sure that we did a very good job and were successful in doing it.
These two regions are the focus of our project.
The main challenge was the sheer number of children to be reached. With that comes a very large number of community health workers that need to be trained up, organized, equipped, and accompanied as they go out with preventative malaria medicines.
Within a period of 3 weeks, we had to do a cascade training beginning with over 600 health workers who in turn had to go down and train about 20,000 community health workers who had to do the social mobilization of the population and distribution of drugs.
When you're faced with difficult, challenging moments, when you think the impossible is impossible, you don't have an option. You just have to do it. Because you know that you're a part of something that's really important.
As an agency, CRS was able to proactively solve problems, take the learning and apply them to the context here in Cameroon, and really help the Ministry of Health and National Malaria Control Program.
Before the implementation of SMC, children under 5 in the 2 northern regions constituted 60% of the cases and the deaths due to malaria. But after implementing the strategy, we have reduced to less than 20% the children who die from malaria.
Over 1.5 million children are protected. Over 1.5 million children are alive because of the work that team at CRS has done over these past 4 months. Being a part of that makes me feel very, very, very proud that we were able to make that contribution to the people of Cameroon.